Hello and welcome to the 2024 Flooring Resources Corp Benefits Overview. Benefits eligibility. After a 90-day waiting period from becoming a full-time employee, which is 30 hours or more per week, you may be eligible for benefits. Let's talk about qualifying events. During the year, if you were to experience a qualifying event, which is something like getting married or divorced or having a baby, you have 30 days to let Michelle know so you can make any changes you wish to your plan. That includes dropping or adding to. 2024-25 benefits package. There are two plans offered at Flooring Resources. Let's talk about the first one. The first one is on the Nexus network. If you notice, there are two in-network tiers, Tier 1 and Tier 2. Let's talk and focus on Tier 2. This plan has a $5,000 deductible. And this deductible applies to office visits, specialist visits, lab and x-ray, almost everything, emergency room. Please note that there is an HRA, which is a health reimbursement arrangement with Flooring Resources. If you are a single person, you will be reimbursed the first $2,500 of this $5,000 deductible. If you see a Tier 1 provider, this plan pays at 100% opposed to 80%. But if you don't want to be limited to unlimited network, you don't necessarily have to stay in Tier 1. You can have 80% coverage if you see a Tier 2 provider. When you log on and you review doctors and hospitals in the Nexus network, it'll clearly indicate Tier 1 or Tier 2. PPO plan offered at Flooring Resources works the same. It's just on the core network. For all things, the deductible will come in first. That includes office visits, specialist visits, emergency room, prescriptions, lab and x-ray. So the first $2,500 will be paid for by Flooring Resources. The second half of that, $5,000, the second $2,500 will be responsible by you, the employee. If you choose family coverage or employee or dependent coverage, Flooring Resources will pay $5,000, the first $5,000 of that $10,000 deductible. And of course, when you hit your out-of-pocket maximum, that is your worst case scenario in a given year. So for a single on this plan, it's $6,350, and for a family, it's $12,700. That includes the deductible we just talked about. When you are looking at providers on myuhc.com, you'll want to go to find a doctor, a little icon that looks like this guy here. And you'll want to choose employer and individual plans. There, depending on which plan you are on, you'll want to choose either the core or the Nexus ACO OAP network. Put in your zip code and you are good to go. Remember, when you are in the Nexus network, if you are looking up Tier 1 providers, you'll see a Tier 1 provider icon that looks just like this, a little circle with the number 1 inside it. Let's talk about the HRA plan offered at Flooring Resources. The HRA is owned by Flooring Resources and put in place to allow Flooring Resources to pay towards the portion of your deductible that is qualifies towards eligible medical expenses. Ameriflex is the vendor that Flooring Resources works with for your HRA. So Ameriflex will pay claims on your behalf once your portion of your deductible is satisfied. The in-network deductible for any employee is $5,000. Flooring Resources, remember, will pay the first $2,500 of that deductible, and the next $2,500 will be paid by you, the employee. For all other tiers, employee spouse, employee child, or family, the deductible is $10,000. Flooring Resources will reimburse for the first $5,000 of that $10,000 deductible. The next $5,000 would be paid by you. And here's the chart that shows these this schedule. Let's discuss some tips on how to save money. When you go in for your wellness exam, make sure you let your physician know that you are there for your wellness exam only. Don't let them know that you have a rash as well, because they may code that visit as diagnostic, and it won't pay correctly. So when you go in for your annual exam, make sure you let them know that you're there specifically for your preventative exam. There will be no cost to you, no copay, no deductible. Also, remember that you guys have emergency room coverage, and sometimes this includes ambulatory care when you use an ambulance. Ambulances are not in network with any insurance company. They are a third party and in charge out of network. This chart here just likes to show some of the different levels of care that you guys have. Emergency rooms cost sometimes well over $1,000. You guys have access to urgent care visits, regular office visits, or specialist care. Minute clinics, those are the care clinics at CVS or Walgreens. And then you have access to the nurse chat as well. Sometimes you need to have an MRI or a scan. Sometimes those services cost 2/3 less at a freestanding imaging center opposed to hospitals. So make sure you log into your app and use the cost estimator to find out where you can have the cheaper high cost scan that you need done. Also, for prescriptions, a couple things to note. Make sure you try to get generics if you can when available. Ask your doctor if they have any samples. Separate from that, you may need to take advantage of the generic program. Otherwise, you may have to pay the difference depending on your insurance program. Remember that there are services out there like GoodRx that are sometimes financially advantageous. You may have to transfer your prescription to a different pharmacy, but what's nice about it, it'll let you know where the cheapest pharmacy for that prescription is in your area. Also, if you take chronic medications, you can sign up for the monthly mail order prescription program. Remember that your health plan offers virtual visits. These have become increasingly popular, especially since the pandemic, but these are great. It's 24/7. All you need is your phone or a laptop. You can initiate it there. Within about 15-20 minutes, you can have a doctor visit. This is popular for conditions like bladder infections, bronchitis, colds and flus, rashes, pink eye, sore throat, and just general advice. Talk about the ancillary benefits offered at Flooring Resources. The dental program with UNUM offers an annual maximum of $2,000. That's an increased plan. That's pretty high. The deductible on this dental plan is $0 in network, $25 if you go out of network. Preventative services are covered at 100%. Basic services like fillings are covered at 80%. And major services like crowns are covered at 50%. This plan also offers orthodontic coverage at 50% with a lifetime maximum of $1,000. This plan also has an out-of-network upgrade of a usual and customary charge of 90%. So should you go out of network, although you have to file your own claim, you will still get a reimbursement check back from UNUM that would pay about the 90th percentile of what other dentists charged in that area. Your vision plan with UNUM partners with iMed. You'll want to visit www.imedvisioncare.com to look up participating providers in your area. Remember, you always get more bang for your buck when you stay in network. When you go out of network, you have to file your own claim, and you're usually just reimbursed a small reimbursement check. In network, you'll pay $10 for your annual routine exam and $25 for your materials. Your lenses you're eligible for new lenses every 12 months and new frames every 24 months. For your frames and contact lenses, there's a $150 allowance with a 20% balance off of the balance with some providers, not including those like Costco or warehouse providers. Your employer pays for a $15,000 life insurance policy. If you are to pass away in an accident, the policy will pay out twice, with the potential of paying out up to $30,000. Remember to keep your beneficiary information updated, not just now, but anytime during the year. A couple things to note about your life policy at Flooring Resources. Should you leave the organization, the policy is portable. You'll want to contact UNUM and get a quote to convert that over to an individual policy. Also, there's a waiver of premium. Should you become totally disabled, you will no longer have to make the life premiums. And also, should you face a terminal illness diagnosis, there are accelerated benefits. More than the $15,000 paid for by your employer, you can purchase $10,000 increments up to $500,000 or 5 times your salary with UNUM. There is a guarantee issue amount for new hires of $110,000. There is spousal coverage also available in $5,000 increments to a maximum of $100,000 with a guarantee issue amount of $25,000. Children, of course, the maximum coverage is $10,000. That comes in increments of $2,000. And this is something that you would pay for 100% for as the employees. This is voluntary coverage. Anything over those guarantee issue amounts, you will need to complete an evidence of insurability form. And sometimes underwriting may request additional doctor's records, so you might want to keep an eye out for any correspondence from UNUM during that underwriting process. Flooring Resources has decided to pay for our the claims advocacy program. This program allows you access to the claims team at Marsh McLennan. So there is a phone number noted here at the bottom and an email address. These folks are available to you Monday through Friday from 7 to 5 p.m. Central Standard Time. You can call them with any questions you have about how the plan works. You can call them if you have any denied claims. They'll help you with any appeals or grievances. If you need any help navigating the portals, finding an in-network provider, understanding those bills that come in, or those EOBs. If you have any problems with your prescription plan, if you need prior authorization or pre-certification, they are there to help you from beginning to end. So please make sure you guys take advantage of that. The number is listed here, and remember, they are available Monday through Friday, 7 to 5. And lastly, but certainly importantly, there is a 401k plan available at Flooring Resources. You can make pre-tax contributions to your account up to the IRX calendar maximum. If you're over 50, you are allowed to make an additional catch-up contribution. You can increase and decrease your contributions at any time, and the annual max for employees annually is $23,000 currently. This concludes the benefits overview. If you have any questions, please contact Michelle Sloan or the Marsh McLennan Claims Advocacy Team with any questions about the plan or how it works. Thanks so much for your attention.